Nuntio, directing healthcare delivery. We identified the problem by talking to doctors from several different hospitals, and they all had a similar thought. There needs to be a way to make triage easier on the hospital's end. Dr. O'Keefe from Emory Healthcare pointed out that clinical management tools are being developed ad hoc at each site of care. There are no validated tools, nor tools that span from outpatient to inpatient settings. Another facet of this issue is that many hospitals are low on resources, and patients are sent home when they cannot be treated. Thus, it's equally important to increase communication between hospitals to maximize the number of patients who can be treated. In a follow-up interview, one of the doctors we spoke with said that he hopes that nurses and doctors could easily access a mobile app in which they could input patient symptoms and risk factors to support decision-making. Introducing Nuntio, a universal, user-friendly app for doctors and nurses. Nuntio consists of 3 simple steps: collecting symptoms and resource availability, automating decision triage, and connecting care. The first step is the collection of information, consisting of 2 elements: hospital resources and patient information. In setting up the app, a healthcare worker will input diagnostic information about the equipment that a hospital has, such as PPE or available beds. The second element is patient data. Basic health metrics such as age, heart rate, temperature, and oxygen level are collected by a healthcare worker. Additionally, COVID-19 specific symptoms and comorbidities are collected. There's also an option to input other symptoms the patient may be experiencing to accommodate the potential of the virus to evolve and manifest with other symptoms not previously seen. Once the information has been collected, our app will move on to the automated decision triage. Our tool supports decision-making by generating a specific treatment protocol based on the patient's information and the hospital's capability. This treatment protocol is determined using an algorithm trained on existing data. Based on the outputs of this algorithm, patients will be classified into either low, intermediate, or high risk for hospitalization. However, if the hospital is deemed to not have the resources necessary for treating the patient, the app would implement the final step, which is connected care. In the case of insufficient hospital resources, patients will be referred to a nearby location where treatment would be provided. By doing so, not only are patients informed about their health condition, but they are also informed of alternative options in receiving care. As for the mechanism by which we will accomplish the steps described above, we propose using a Python-based decision tree that uses the available COVID-19 open resource dataset and A-minors open resource dataset in order to train and test our algorithm to ensure we will be classifying our patients into the correct tiers. Based on the patient checklist inputs, points are assigned to each symptom, and combined with a decision tree according to the guidelines from the CDC and hospital, patients are then classified into Tier 1, 2, or 3 risk, corresponding to different treatment plans. For our hospital resources page, we use another decision tree in order to assess which resources are available at the hospital and the ability to support that patient. If the hospital is unable to support the patient, the app will use location services and give the hospital options as to where they can send the patient. The hospitals will be ranked in order of which hospital can support the patient best, which will be determined using the scikit-learn library. Concerning privacy, the database that will be used to store patient data is HIPAA compliant. Given the design plan for the app, it will also scale easily in terms of back-end and front-end capabilities and will be cost-effective. The impacts of Nuntio are extensive and expensive. Primarily, it saves doctors an enormous amount of time dealing with information processing. Furthermore, it creates a unified system for the collection and analysis of patients' data. This can also lessen the negative mental health impact on healthcare workers resulting from these difficult triage decisions. Lastly, and of the utmost importance, the app will optimize the use of hospital resources by bridging the information gap between hospitals.